Good night, everyone. My name is Katrina Aline, President and founder of the Katrina Endometriosis Fund Association of Barbados, and I'm here with the one and only.
Queen Archibald got WWs.
Today is the beginning of Endometriosis Month, and we celebrate Endometriosis Month for so many different reasons because so many women in Barbados and worldwide are affected by this debilitating condition, endometriosis.
Right.
Endometriosis is where the lining that
I trying to get my phone started with you, so talk.
endometriosis is really lining that normally lines the inside of the uterus, grows outside of the uterus, also known as the endometrium. Every month, when a woman has a cycle, this condition makes having your menses very, very, very painful and debilitating. Some of the symptoms of endometriosis is heavy bleeding. You can have it on your bowels, you can have it on your intestines, your bladder, the arms, the legs, your sciatic nerves. Anywhere you can have endometriosis since it's not a localized condition. Queen, you're paying attention, you
I
know.
listening to you, I listening to you. You trying to get things here sorted. I answer fast for these new tech things, you know. You trying to get this here sorted so you can get the thing. So you can get other people share the thing. I know how to do this thing here, so I need before anyone home. I call this here, so I don't know what's going on here, so
Big Friday night.
yeah, well. Right, so talk, let people know what's going on. So this is endometriosis month, right?
Yes, it is.
So you're celebrating something, but you're trying to inform people living old school keeping.
Well, we celebrated. We also informing because it's strictly about awareness and sensitization. And even though that we are breaking the silence, a lot of people still do not know what endometriosis is. Furthermore, they just want to know what is this big word. I use a good example.
No, not me. I got some old school here. So what y'all got planned for this month here, though?
Well, this month, since it's Endo month, this month we are actually having our seminar on the 9th of March. This seminar will be conducted at DB Southwinds from 5 to 8 p.m. And we are going to have 5 doctors inform you about endometriosis and different areas in which endometriosis can affect you.
Okay, I find it. I see what the guy thing is, so I do know. I got it, work out. I got it, work out. You got the newfangled thing here, so work out.
So we have Dr. John Barker. Topic is laparoscopic management of endometriosis and the development of an endometriosis center in Barbados. And this topic is very crucial to women with endometriosis because we search continuously for a doctor that has knowledge of how to treat endometriosis because endometriosis treatments for me are band-aids. There's no cure for endometriosis. So, we try to find the right doctors that would be willing to treat us rather than try to excuse me, rather than try to eradicate the illness because there's no eradication. Try to treat us the best way they know how. Whether it's birth controls, whether it's pain management, whether it's surgeries, some form of treatment that fits you best. We try to get happening here with our doctors.
Right. The next other question I can ask you. From what age does this really affect you from range to range? From 10 years, from 5 years old to your day? How this thing is really work? How school is keeping this here?
Well, endometriosis can start from your first period. And I would say some people get endometriosis at any age. You don't know you have it. You go through life thinking that it's okay to have bad periods. Because back in the day, nobody want to talk about periods. You understand? So it was okay for you and everybody to have bad periods. If you don't have pain associated with a period, it wasn't okay to have one. So it is very painful. It's very debilitating, but as I say, you can have it from the age 10. You can have it from age 10. I started my period at age 10, and I only found out I had endometriosis when I was about 29. And I
You
was,
so old, about 65 years old, right? That's about 30, 40 years ago. Okay, you are time, got it covered.
I really like you tonight, you know.
Don't worry, age is just a number.
You know?
You look good for your age, so I thought, man.
Thank you.
Sorry to interrupt.
You know? But at age 13, I mean, I was having periods out of this world, very painful, very heavy. And as I say, it was okay to have bad periods. But as time went on, bleeding get worse, pain get worse. You know, you try all kinds of different medications. But the only thing about endometriosis that is very, very vital and important is that you cannot diagnose endometriosis without having a laparoscopic surgery.
Wait, stop. That's a big word there. What do you mean?
Laparoscopic just means keyhole surgery rather than having a cut.
Wait. That means you're going to a keyhole now with it? You're operating to a keyhole?
No, these doctors have a small camera which is inserted into the tummy.
Right.
In some small holes to look inside the tummy.
Oh, sorry, man.
Yeah. So they could diagnose if you have endometriosis by the deposit seen within the abdomen.
Oh, so you're saying is that sometimes you may got a very painful time in the month, but you might not necessarily have endometriosis, but you could possibly have it, but you could still got get diagnosed.
Definitely.
So you can't diagnose it yourself, basically.
No, please.
Okay.
And most of the time, a diagnosis could take up to between 7 to 12 years. Sometimes longer.
So you watch it, they don't know office for 7 years for you to find over around here? Well, I'm not going to say this one. You just said that about 7 years to diagnose. So this is all the time money get either boy, you got a place, talk to me, you know, school given.
But you know, as I say, it's not something that you can be seen through ultrasound. Okay, women that have adenomyosis, fibroids, and that kind of stuff, cysts, etc. These are things that can be seen with an ultrasound. It's different with endometriosis. You cannot diagnose it by ultrasound. So you definitely have to have the surgery. So that is why you can have that long process, you know, of time after time, doctor after doctor, because it's not something that can be seen with the naked eye.
So this surgery thought to me was a piece of change, or what this money is worth out?
Well, depends on 1, the surgery, 2, the doctor, 3, what is needed, because sometimes you may have a surgery where you would already give consent that if they go in and you have endometriosis, that they would remove the tissue, because the tissue is stick all the organs together. So it's very, 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 very complicated.
Stop, back up, you truck there a little bit. Back up. Let me go on the earth behind the truck coming back. Talk to me, lovey. So you said, explain all this tissue. You talk about napkin, toilet paper, what do you mean with tissue?
No, I'm talking about endometriosis tissue that builds up over time. Every time you have a menstrual cycle, the deposits, you get new deposits all the time. So there's no reason why when we get endometriosis, the main reason people use is the backflow of which is also known as retrograde menstruation. So instead of the blood flowing downwards, it flows back to the tubes and then it deposits in the tummy or wherever else you can find to have the tissue deposited.
Oh, see.
Yeah.
So then these tissues will swell out and grow or something. Talk to me. But you say stick together the other things.
Well, it sits together the organs based on, as I say, length of time, because it's something that continuously grows.
When you say your organs, what do you mean though? Your nose and your mouth, what do you mean?
I mean like your uterus, your intestines, your bowels, your urinary.
Gizzard. I just come to learn.
You get this gizzard. You're talking about the chicken saying you're talking
So you
about
know
gizzard.
what gizzard or so?
I already.
Just the certain things, the uterus and
The organs, the tubes.
Oh,
Melts.
but I trying to learn, but trying to understand. They don't laugh at my people here so tuning. Good evening to you, Roger.
The tubes.
There's lots of people here so tuning.
Good night, Benita, Christine, Joel, Roger, Kanisha, Saskia, Lynn.
Listen, don't laugh at me. I'm trying to learn something.
You know, so it is really complicated, even though people think that it's just a bad period. And endometriosis affects you in many different ways. There are people that have endometriosis that cannot work, they cannot function, and if they do function, they are highly medicated because the pain is so debilitating. So, you know, you get a lot of issues in workplaces with productivity. You find a lot of endometriosis women losing their jobs because they have to be home regular, you know, taking a lot of sick days, a lot of sick times. And the thing about it is that you do not even have time. It doesn't even notify you that you're going to have a flare. It just happened. So I could be
What
talking.
you call a flare?
A flare is like,
It just bring out all the
yeah,
blood.
just bring out the blood.
Oh,
So, you know,
right, you can't take two little tablets, two little a bit of the fence, no, that was sorrow thing.
there's still solvents.
I know you say,
Well, to be honest with you, when you have a flare and it's a really bad flare, even though you take oral medication, sometimes the oral medication is just be like a mint. It don't work. You know, you just take it and you hope that it works, but it don't work. So you got actually get up now, go to the doctor, whether it's FMH, hospital, you know, and you got to actually have IV medication. And sometimes these medications are as strong as morphine. So that could tell you how.
who's IV? You mean IV that live at the road? She said medication now? She was looking at me, you know.
Introduce.
She was looking at me. How IV that selling medication all of a sudden? She said, what you lock shit, you know? She go off and selling sugar cakes. Robin said, right now she's selling medication.
Queen. IV.
I was saying police for you, you know.
Queen.
She's selling sweet bread, she's doing all kind of things. She's selling 4% beer, she's doing all kind of, no, she's selling medication.
Queen.
Oh, if you want locking up.
This is you find IV talking about.
You know what I mean? You talking about?
No, I mean IV for my topic. Yeah, I talking about IV, which stands for intravenous medication.
Oh, that's a
Yes.
doctor word.
The drips.
Oh, the drip.
Yes.
Oh, no, you mean things put in your hand.
Yes.
That's what, whatever it is, a top there, so dripping on your hand.
Say you were coconut water. Well.
You think you want water there, like, you think, like water or whatever it is.
Listen.
I understand, you know, what you mean, I be at the road at the cell.
You can get somebody locked up, you know.
What is IV? Well, so you're talking about sometimes the pain is so bad, you got to go to the clinic or the hospital or anywhere. So
exactly, get IV medication. Sometimes
you
you even have to have gravel because sometimes when the pain gets that bad,
just grab it all.
Yeah.
You understand your word?
I want listen, gravel, GRAVOL.
Oh, that's another medicine.
Yes.
Oh, another okay.
You're right.
Got you.
Gravel is used for vomiting, and sometimes the pain gets so bad that you can't eat anything. You just throwing up. So you get dehydrated. You know, you get all kinds of dizziness, dark eyes. Sometimes you faint because the pain is so bad and the bleeding is so heavy. You know, some people have to get blood transfusions because we lost so many blood.
Wait, tell them at all.
Yes, that's serious.
Okay.
You know, so you know you get your blood transfusions sometimes in and out of hospital. You know, you're trying to get your life on track, and you know every minute you gotta be in hospital because and then that you want to go there or you choose to, but you ain't got a choice.
You pay that hard.
Yeah, sometimes it's one dead man. I'm telling you.
Okay.
From experience, sometimes it's one die, but you know.
And this thing can happen. How many times a year? That can happen anytime at all.
Anytime a year. Sometimes every other month. You know, sometimes you might get a good month depending on the medication you're on, how the birth controls treat you. Sometimes, well, you know, there's the GnRH injection, which is a chemotherapy injection used for breast cancer and prostate cancer. So women with severe endometriosis usually go on this drug, and it's a 6-month course. It's once a month for 6 months. So you would get hot flashes because it puts you in the menopausal stage.
I was like, I know.
You're going through that a long time. You know, menopausal stage. You get sometimes you get hair breakage. You gain weight. You get a lot of nausea. Being nauseous a lot. Headaches. It can also make your bones very brittle. You know, so you gotta be very careful how you take this drug. But it stops the period, so it gives you a break from all of the drama.
Okay.
But you still get pain. But and the thing about it is that it actually gets worse before it gets better. Making sense to you?
Yeah, the economy right now, so I think, you know, me got things rough right now. Hopefully things will get worse before it get better.
Yeah.
I think there's a good analogy.
No problem. I could deal with that.
Okay, good.
You understand? But you know, it takes a lot out of women with endometriosis, and it affects not just everybody thinks that endometriosis is a women disease. But
Not the genital?
no, but the trickle effect,
Uh-huh.
the relationship aspect, because there are men that do not understand what endometriosis is. You know, they don't understand what endometriosis is. They don't understand the associations that come with endometriosis. So a lot of the time you would find that relationships fail due to the fact that men have a lack of knowledge. Because, okay, as we was talking about location of endometriosis tissue, sometimes there are women that have endometriosis tissue in the vaginal cavity, right? This makes it very painful and difficult for women to have sex.
Woo! Horn coming, boys. How you so horn coming, horn coming real. What's talking to?
It is true. You know, so a lot of relationships fail based on this aspect. Also, most men don't understand that sometimes it's not that you don't want to have it, but sometimes you're just ain't able because you're in pain. Sometimes you do have it, and then when you're finished, you get a lot of spotting, you get a bleeding, you get pain. So, you know, depends on the area, as I say, and this goes mostly for women with endometriosis in the vaginal cavity. They have some women that have endometriosis that, you know, it doesn't even affect them. And it doesn't even have to do with the stage because there are 4 stages. But it doesn't have anything to do with the stage because you can have some person that have stage 4, which is severe endometriosis, and don't have any pain at all. And then you can have some person that has stage 1, and the pain level is crazy, it's off the charts. So I guess it's based on the individual and the location of the tissue.
Oh, I see. All right. So it don't affect everybody the same way.
No, please.
Some people will be able to percolate normally and naturally.
Yes.
Without any kind of problems.
Yes.
And then some people has got some problems that thing every now and then.
Yes.
They've got a little problem and thing. Oh,
Yes.
yeah. I see how school keep it
Yes.
now. Oh, so you understand you got some big seminar coming up. Is next month?
Next week.
Next
week Saturday.
What is March now?
Yeah, 5 to 8 p.m. at DB South Winds.
Uh-huh.
You don't want to miss it. You do not want to miss it. And the collaboration of doctors are here to give you all the information that you need. Especially Dr. Barker. You know, he's looking to open an endometriosis center in Barbados. And to me, I think that this is a big step, not just for Barbados, but for endometriosis patients, because we need it. We need more, you know, sensitization no more than ever, because the vast amount of numbers that are coming down with endometriosis, there's no help desk for endometriosis, but even from surgeries at the hospital, 40% of the women that actually have hysterectomies, have fibroids removed, adenomyosis, you know, a lot of them have endometriosis, and that's a vast number. 40% is a lot of women that have this condition.
Let me ask you a question here, though. Because you say this is affecting certain places. So if you get the, you call it big word here, the
Hysterectomy.
Hysterectomy. That's better remove
Yes.
everything done inside there and everything. Okay.
Yes.
So you remove everything done, then you get rid of endometriosis then.
No. It ain't that easy. If it was that easy, everybody would get hysterectomy. But it ain't that easy. Some people have subtotal hysterectomy. Some people have total hysterectomies. A subtotal hysterectomy just means that you just remove the uterus and everything else remains: cervix, tubes, ovaries, everything else. If you have a total hysterectomy, the tubes, everything is removed. But the thing is about the endometriosis thrives on estrogen. Yeah.
What would I say?
Estrogen is the hormone that females carry.
Okay.
Yeah. So, you know, even if you have a subtotal, you remove the uterus to compensate for the bleeding and the loss of blood monthly, you're still going to have the effects of the pain because you still have the ovaries. 1, 2, you might have endometriosis on the bowels, and having endometriosis on the bowels, you know, when you defecate, you have a lot of pain as well. Sometimes you can see blood in the stool. Yeah, so you know, it's a whole can of worms when you talk about endometriosis. So everybody just think endometriosis is just about periods. it is way more than just a period. And for me, it takes a lot from any female that has endometriosis.
Thank you, Benita. Benita said a lot sexy.
Sexy
Just a
one.
little one thing here, tossed on, you know.
You want me? You want me? She figure
That's a little thing to toss on here. Right. So you say that you got the seminar coming up next week. It is at Divi's.
South Winds.
Time.
5 to 8 p.m.
A little change it. You got the change if you want.
Yes. You know, it's $20 for the public, $50 for the nurses, and we are giving credits, and $150 for doctors. They are also getting credits, so come out, you know, get educated. I mean, this seminar is big, it's going to be huge, you know, and the topics are to die for. When I say to die for, you need to hear what these doctors have to say.
That's what you to die for thing. I ain't ready for that part anymore yet.
I really did it with you, you know.
Right, so you know you went or there with the doctors to talk about or whatever thing, because you just say a more full day with a lot of things that will be going on and a lot of things, how things affecting people. So I believe that the doctor will probably come and tell you with the laparoscopic thing, yeah?
Laparoscopic surgery.
Right.
So as I was saying, Dr. Barkley is going to talk about laparoscopic management of endometriosis and the development of an endometriosis center in Barbados. And you also have Brenda Roach, she's a psychologist, because you know, when we talk about wellness and we talk about mental health and stuff like that, you know, endometriosis can play on your psyche. And I mean, when I tell you play on your psyche, sometimes people have suicidal thoughts because the pain is that excruciating. So we're going to have Dr. Brenda Roach. She's going to be talking about the psychological impact of endometriosis. And that is a topic that I really want to hear because, as I say, a lot of females, you know, have mental issues and stuff like that. A lot of depression, you know, and depression with endometriosis is real. And I mean, when I say real, I mean real to the point where you depressed, the pain got you.
But by the way, we got on side depression from the point of view that first, most people may not be able to percolate. You understand what I mean? Also,
trust you, the system.
You got step on that car, but that's a serious car you're walking with.
It's true.
So and the other thing is, you just say that sometimes you can't work.
Yes.
You go work and you can't keep a job. I know what Barbados says.
Exactly.
You're at work, you're barely earning, you go on left work. Some people say you're pretending. You know, some people all this.
Yeah.
She got all this cotton. She always come in, so like they all this work from my one and that kind of thing. So when people hear that kind of talk and thing, it's got you feel kind of got you feel depressed, so you would understand.
Exactly.
So this gentleman here would probably come and talk. Is my only money?
Brenda Roach.
Oh, Brenda.
Yes.
Oh, that was Roach last time.
No, please. You know, so you don't have to feel like the black sheep because, as I say, you know, you feel like a black sheep in certain environments because the stigma attached, even especially in workplaces, is crazy. You know, if you're going home 2 days a week. Oh, the boss gotta be living with she or the boss favoring she. But in that is that the boss understands what time according to your whole school keeping. You understand? But when you are at work, your productivity level is high. You know, and for me, your productivity level drops when you are in an environment where you are trying your best and you are not getting what I would say, the support,
but the understanding.
That is the word, the understanding that you need from peers. I would hope so, because
right.
Anyhow, I ain't getting W.
Okay, so you understand that part. So you got the psychologist coming to help you deal with you if you're depressed, experience certain things. Because I would figure that some young girls too at a certain age, you know, you can't understand what's going on with the bodies.
Yes.
You know, you can't understand why they've got to go through this kind of thing. So the Dr. Betty will come and deal with it. Who else you got there? So I
got Dr. Courtney, and she's talking about implications of endometriosis in adolescents. And this is a big topic because there are so many teens in Barbados now experiencing the pain associated with endometriosis. And some of the parents are in denial. Some of the parents are lost because they don't know or have any information about endometriosis. And then some of the parents as well compare with other children. So for instance, if me and Queen got the same mother, Queen had a lot of pain with she period, I think, because you know how she is. Anyhow, she had a lot of pain with her period. But for me now, I have all the symptoms of endometriosis, you know, all the symptoms, the pain, the vomiting, the ability, the not having the ability to walk, etc. You understand? And then parents will say, oh, but I don't know you again also, because Queen has she period and she had no problems. Mommy, are you Queen?
Oh, you understand.
You understand what I'm saying?
Right.
So, you know, I this is a very important topic for parents as well because you know they need to listen. You know, some people might say, "Oh, you don't want to go to school or whatever. The belly hurt can be that bad," but trust me, the pain is real.
Okay. So you got Dr. Courtney, you got Dr. Betty.
Who's Dr. Betty?
No, just call Betty somebody.
I said Brenda Roach.
Oh, Brenda. Miss Roach.
Yes, Miss
Dr.
Roach.
Dr. Roach, you know.
And then we have Dr. Saheli Griffith. He is talking about the He is talking about the collateral implications of endometriosis. And this is another topic where you would talk about.
That's colorectal or collateral?
What you say? I said colorectal.
No, you said the collateral.
Sorry, colorectal.
Oh, good.
I was coughing.
I can read. I know y'all some malicious.
Listen.
I read people's phones over the show.
Listen to me.
On the bus. Go down.
Listen, you got me coughing.
All right, go down.
Excuse me. Right? He'll be talking about that topic as well. And then we have Dr. Adrian Waterman. He's talking about all the non-surgical management, pain management for endometriosis. So, you know, we have all these topics, so much education to gain, you know, so much questions to be asked, because you know we're going to ask a lot of questions. Endometriosis patients normally ask a lot of questions.
All right, so come out. Didi South Vince is next Saturday the 9th of March from 5 till about 8 o'clock also.
Yes, please. 8 p.m.
Right. $20 for normal people.
$20 for the public, $50 for nurses, $150 for doctors, and bear in mind you are getting credits for these seminars, both nurses and doctors.
Oh, so many doctors and nurses attend these seminars. This is good to award them.
Credits, yes.
Credits,
yeah, it's supposed to get a certain amount of credits per year.
Oh.
So we're starting the ball rolling.
We just started it early. So this is endometriosis month. Well, you how you got a shirt this for you for you.
But I had on my yellow shirt this morning.
But you look so pale, you nasty, right?
No, that's happening when you bed.
Oh.
Yeah.
Okay.
That's happening when you take a shower.
Okay.
But yes, yeah, the Friday was today, and you know it came off great. A lot of people participated. I want to thank everyone for participating this morning. It was great, and photos are still coming. Just that I haven't finished up here to post the rest of the photos, but you know the response has been great on IG, Facebook, you know, and all the endo groups that I'm in, etc. Also, there's a book coming out on March 19th, a compilation of authors around the world. Sylvia Young is the publisher, but you have people from California, USA, Wisconsin, New York, Texas, and of course you have the 246 in the building, you know. So we are actually going places with this. Hopefully later on in the year too, I'll be releasing my book. You know, I would say from probably looking to do it in October.
Sounds good.
You know, I probably might write something in the book about Queen, because
No, you left me. You left me. You don't revolve me, you things. You don't let me revolve you things. All right, so we almost finished here, all right?
yes, please.
Right.
So this is just the launch. Next week Friday we are back here and we are going to talk about.
You get here early this time, here?
Yeah, boy. You know how it is.
We will let it start from about 7 o'clock on a Friday evening.
We started at 7. Definitely next week. Sorry for the late start. As I say, we were supposed to start at 7, but traffic, transport, etc. Tapped into the time.
I mean, you're on the bus here too, so that makes it worse. All right, so Next week, Friday, from 7 o'clock, and we can be only discussing endometriosis, but we can widen it up a little bit. We can be talking about relationship problems and things that are happening in the home and different things, you know. This is month for endometriosis. So I'm looking forward to seeing you next week, Saturday, at Davy South Winds, from 5 o'clock until 8 o'clock for the endometriosis seminar. Right?
Definitely.
Bring your children, bring your husbands, bring your friends, and share this video. This will get posted shortly, and share it for those people who didn't get a chance to be part of it. Okay?
Endomotion level 2 is the theme this year for our endometriosis seminar. So I'm looking forward to seeing all of you there. And just because you don't have endometriosis, that doesn't mean that you can't come, because someone close to you or someone that you may know may have endometriosis. So just get in the know.
Listen, no last two of there, the rice there burning. Sorry, the rice there. You guys smell rice there burning? I got little boy right there, so I can really all day for you.
Man, when the boy fall, you can't cook.
But no, the rice burning, hurry there, so you
Damn, you can't cook.
Anyhow,
Anyhow, thanks for watching. We're going to see you back next
week. Turn on the stove, you're gonna let the rice burn up. Sorry.
Next week, Friday at 7 p.m. Same place.
Same time.
Same time.
Same thing, 7 o'clock.
Same place, 7 p.m.
Right on.
This is Katrina Allen here.
Queen Archibald Talks.
Good night.
Good night, everybody.
Look.